Kneecap pain is one of the most common causes of pain, and it's characterized by sharp pain in the front of the knee, usually when going up and especially going downstairs, or pain in the front of the knee when standing from a seated position, especially if you've been sitting for a while, or standing from a squatting position if you're squatting down on the ground, or if you're sitting down on the ground Indian style and then you go to get up. Sharp pain in the front of the knee. The worst case is you can actually get an aching, burning pain in the front of the knee with just sitting for a prolonged period of time. So that kind of pain is called patellofemoral syndrome, or also kneecap pain. And in this video, I'm going to tell you the 3 mistakes that you might be doing that's causing your kneecap pain. I'm Dr. Brad Homan, board certified orthopedic surgeon. I'm an expert in knees. I've been treating knee pain for 25 years. So let me start by telling you a little bit of anatomy about the knee and the kneecap. So in my plastic knee model here, the kneecap is the bone in the front of the knee. The back of the kneecap has a V shape, and then there's a V-shaped groove on your femur. As you bend and straighten your knee, your kneecap glides up and down into this groove. Now, the best place for the kneecap to be is right in the middle. If it's tilting one way or the other, that can put abnormal pressure on it. Oftentimes, if it's moving around too much, that can put abnormal pressure on it. And those things can cause inflammation in the back of the knee, which is going to cause you pain. So if you like this content, please like and subscribe and share with your friends. Let's get to it. So the number 1 mistake that can be causing your kneecap pain is not exercising. The muscles in your thigh attach to the kneecap. And so, like I said, as you bend and straighten your knee and do movements, that kneecap is gliding up and down into that groove. If your muscles are not strong, if the muscles are not tight, and it's not keeping your kneecap in the middle, it's allowing that kneecap to potentially tilt around or bounce around. That's going to create inflammation. So the patients that get this condition the most are the ones that are sedentary or do not have a regular fitness program for their legs. And typically what'll happen is they go up and down a bunch of stairs more than they're used to. Perhaps they were on vacation or on a cruise ship, going way beyond what they normally will do, and their kneecap gets overwhelmed because their muscles aren't strong enough to handle that activity. So mistake number 1 is not being involved in a regular low impact exercise program. Mistake number 2 is doing the wrong kind of exercise. So some patients that actually exercise regularly can get potential bouts of patellofemoral syndrome if they have an injury or if they do a little bit more than they're used to. And when you get that inflammation behind the kneecap, it can be very difficult to get rid of. And so one of the common exercises that will aggravate patellofemoral syndrome or kneecap pain is going to be impact exercise like running. So for patients that are runners, they get kneecap pain, the best move is come back on the running a little bit, rest for a short period of time to get that inflammation to go away, and then get back into the exercise on a gradual basis. Another exercise that can be very painful if you have kneecap inflammation is heavy squats in the gym, or an exercise called leg extensions, where you've got weight on the ankle and you're forcibly straightening out your knee and pushing against that weight. If you've got patellofemoral inflammation, those exercises are going to push that kneecap against the femur even harder, and it's going to prevent your body from being able to get rid of it. So the 3rd mistake that could be causing your kneecap pain is not addressing the inflammation that's causing the pain, not recognizing the significance of the injury. And the reason I say that is kneecap pain can get flared up by just regular activity once you have it. I mean, you're literally walking on your knee all the time. You're sitting, you're standing. Every time that kneecap gets pushed against the femur, it's creating potentially some more inflammation. So the 3rd thing is appreciate that that inflammation is there and try and get rid of the inflammation. And that usually will involve a little bit of activity modification for a while, cut back on whatever aggravating activity that you're doing, use ice to get that inflammation to go away. Before you exercise, you want to warm up that knee and do some stretches and some warm-ups before you put any load on the knee. There's a role for taking non-steroidal anti-inflammatory medications like Advil and Motrin if you don't have contraindications to taking those medications. There's a role for putting a support brace on, typically like a knee sleeve that has a little hole for the kneecap that'll help capture capture and guide that kneecap. So those are the strategies that you can do to kind of reduce the inflammation that you have in your kneecap. And then once that inflammation has come down, then you do a gradual return to your regular fitness program. So ignoring that pain can make it last a really long time, and then you might actually need some stronger medications like steroids. So best to appreciate the symptoms early and try and address it early, and then get back into your regular fitness program. So those are the 3 common mistakes that could be causing your kneecap pain. I hope you found this useful. Again, I am Dr. Brad Homan, board certified orthopedic surgeon, and my message, as always, take care of your knees and they will take care of you.